Hello, I'm Dr. Bobby Cothran, lead veterinarian at Aspen Grove Veterinary Care. Today we're going to talk about, is my pet dehydrated? One of the more common things that people give us a call, their pet may not be feeling well, they might have some other symptoms including some GI distress. They just want to know, how sick is my pet? Should I be worried about them more? And one of the first things we talk about, well, is your pet getting dehydrated? Because if we don't correct that, they can of course spiral, get sicker, and become in need of just more aggressive veterinary care. So some of the things that we can talk about to start with includes just checking their behavior. You know, by all means, a pet that is getting dehydrated is probably also getting a little depressed, lethargic, laying around, not interacting with you as much. They might be seeking out water more too. So if they're going to your water glass on the table, if they're heading to the commode in the bathroom, you might want to think about looking for those signs and symptoms. On the pet themselves, you can check a couple things. So we use this every day in our exams to help determine how hydrated a pet is. We start by checking their gums. Any mucous membrane will do, but we generally lift up the lip and look at their gums. Their gums should be a nice, healthy pink color, of course, and they should be kind of shiny and moist. They should be slick enough that your finger kind of slides across the gums so that you know that you have enough moisture. Once we start getting a tacky gum, so when we touch it and it kind of finger sticks a little bit to it, likely that means we're getting a little dehydrated. So tacky gums usually mean about 5% dehydrated. That's just the first sign that you can pick up clinically from a pet, besides some behavior changes. The next thing that you can check is the scruff of their neck. So you can grab a little scruff of their neck and pinch it up. We call this a skin tint test. So we actually tint it up and we release it. And when you release it, it should go right back down almost immediately in a well-hydrated pet. When we're starting to get really significantly dehydrated, that skin tint is going to stay up and slowly go back down. As it slowly goes back down, it gives us an idea of how dehydrated we can be. And that can be anywhere from about 8 all the way up to about 15% dehydrated, which is a severe dehydration. A couple of other signs that are probably beyond what you can check, but a vet would definitely be able to help you out, is when we're getting really sick. We might be getting some sunken eyes, we may not be producing any urine. Those kind of things become a severe, almost emergency situation if they're that dehydrated. So if you do have any questions, by all means, go see your veterinarian. Things that of course you can do to try to ensure that your pet doesn't get just dehydrated in general is making sure they do have some fresh, clean water on a very regular basis. So it's hot outside, they need to have a high level of access to water. Couple of bowls in a clean, dry environment. Make sure that you take those bowls and clean them on a regular basis as well, so they don't get deterred from using those. If you take all of that into consideration, you'll be a lot better prepared in case your dog or cat does get sick, to check for those kind of signs. For more information on this and other topics, please visit the video blog on our website.